The Western Cape Blood Service, also known as the WCBS, is one of 2 blood services that operate within South Africa. Donors and patients are its priority, whilst it facilitates the entire process of blood collection, testing, component processing, storage, distribution, and issuing of blood products.
Dear listener, welcome to this episode of the Lifeblood Podcast. I'm Hayley Arley, Hospital Liaison Officer, your host. A warm welcome to Dr. Caroline Hilton, who is Lead Medical Consultant for the Western Cape Blood Service, our guest. Caroline, I've heard it asked, what is the difference between haemoglobin and ferritin? Can you talk me through the different tests or checks that are done when a donor arrives to donate blood?
Hi, Hayley. Thanks for having me on today's podcast. So we perform quite a number of checks when a donor comes to donate blood. So when you'd arrive at the clinic, you'd complete a questionnaire to make sure that it's safe for you to donate blood and that your blood is safe for the patient receiving it. What we do next is a finger prick test, which measures your hemoglobin. And this is a measure of the red cells in your blood to assess whether you have enough red blood cells to donate. What hemoglobin is the oxygen-carrying protein inside the red blood cell, which has this amazing ability to transport oxygen throughout the body. So we need to make sure that your hemoglobin is high enough to donate, that you've got enough red blood cells to spare. After that, we do other tests like checking your pulse and your blood pressure. And then when you get onto the bed and start the donation, we do another test where we take a sample of blood from the donation, and this is to measure the ferritin level. The ferritin is the amount of stored iron in your body. When we donate blood, we lose those red blood cells containing hemoglobin and iron, and our iron stores are needed to replenish what's been lost through the donation. So we need to make sure that our donors have enough iron stores to tolerate that donation.
Thanks. Why would someone's hemoglobin result be low?
So the hemoglobin, which is a finger prick test, when we test it, for a woman it's got to be above 12.5 grams per deciliter, and for a man it must be above 13.5 grams per deciliter. So if your hemoglobin is low, this means that you have something called anemia. And this basically means you have too little red blood cells, or the hemoglobin containing red blood cells in your bloodstream, which places stress on your body to transport oxygen to the different tissues. So there can be lots of causes for this. A very common cause is iron deficiency. So there's not enough iron in the body to make hemoglobin. And this can be due to perhaps dietary issues. You don't have enough iron-containing food in your diet. There can be other problems like malabsorption from the gut. Perhaps people can be anemic from chronic bleeding somewhere in the body, which would be of concern. Yeah, there can be quite a number of reasons why somebody is anemic or has a low hemoglobin value.
What happens when a donor's hemoglobin is too high?
So we do also have an upper limit of hemoglobin, which is 20 grams per deciliter. If your hemoglobin is too high, then we ask you not to donate that day, but you're welcome to come back on another time to check your hemoglobin, and if it is below 20, we would allow you to donate. So the reason for somebody having a high hemoglobin could be commonly that they smoke or perhaps use testosterone injections. So because this is abnormal to have a high hemoglobin, we'd prefer you to get this investigated perhaps by your doctor, but you definitely would be welcome to come back to donate if you pass the criteria on the next donation.
You mentioned earlier that you take a sample of blood for ferritin testing before the donation. Do you notify donors about their ferritin result?
Yes, we do, if it is abnormal. So just a reminder, the ferritin test is the second test that we do when you're about to donate blood. And this is performed on an analyzer in our laboratory. So you won't get the result then and there like you do for the finger prick test. And we first have to send the sample to our laboratory for testing. And we notify donors if their ferritin level is very low, so if it's less than 15 micrograms per liter, because this would be indicative of low iron stores or iron deficiency in the donor, which can be concerning and it should be investigated. We also notify donors if their ferritin levels are above 500 micrograms per liter, just to advise them to perhaps get this investigated to see what the cause of the iron overload is.
Why would people have raised ferritin levels, and can they still donate?
So again, there can be multiple reasons for this. There are genetic conditions such as hereditary hemochromatosis, where people do tend to absorb too much iron. This can be problematic in that if there's too much iron in the blood, it can be deposited on various organs in the body. So that can be a reason. Again, there could be issues with absorption of iron in the gut, and also in certain inflammatory and chronic medical conditions, you can have a raised ferritin level. So we advise our donors to have this investigated, but they are welcome to come back and donate. We also have what's called a therapeutic phlebotomy program for donors who have very raised iron levels or even hemoglobin levels, where they need to donate blood regularly to reduce either the iron or the hemoglobin. This typically requires enrollment in our therapeutic phlebotomy program via your doctor, but specifically for those people who have to donate more regularly than every 2 months, they would have to join our therapeutic phlebotomy program.
How can blood donors boost their ferritin levels?
Okay, so it's really important for our donors to understand that every time they donate blood, they are losing red blood cells and iron, about 250 milligrams of iron per donation. So very regular blood donation can result in iron deficiency. So we definitely recommend that our donors have a iron-rich diet, but also we offer what we call iron replacement therapy to our donors. So this is a course of iron tablets that they can take after the donation to replenish the iron that was lost in the donation. So we do encourage our donors to take this. We are in the near future changing to a different type of iron replacement therapy that we currently use. And this type of therapy is better absorbed and has fewer side effects. So we hope that our donors will be encouraged to use it.
Thanks, Caroline, for helping us understand the precautions that WCBS takes to ensure that its donors can maintain a healthy hemoglobin and ferritin level. Do you have a closing message for our listeners?
Well, firstly, as always, I just want to thank our amazing donors in the Western Cape for their selfless donations of blood and the many lives that they help. With regard to the ferritin and hemoglobin testing, I think it's very helpful for our donors to understand the difference. So traditionally, our staff refer to the finger prick test that we perform at the start of the donation journey as the iron test. This is in fact the hemoglobin test. And just to remind you, it's a measure of the amount of red cells in your blood stream. You get that result immediately, and then if it meets the acceptable criteria, you are permitted to donate that day. The test we do later is the ferritin test, and that's a measure of your iron stores. It's a different test, and we will notify you if those results are abnormal, so either too high or too low. What I would like to also reiterate is that if your ferritin levels are very low, so below 6 micrograms per liter, we will not permit you to donate blood for 6 months. And this just gives your body a chance to recover those iron stores, and also hopefully for you to get this investigated by your doctor. But yes, I think that my closing message is Just to reiterate that donor safety and donor health is of utmost importance to us. Many blood services throughout the world only perform ferritin testing after the 5th or 10th donation, but we have committed to testing ferritin at every single donation to make sure that we are not compromising the health of our donors.
Thank you for listening in. Until next time, do something remarkable. Donate blood.